Hello, I'm Sarah de Malplaquet, founder of Tarka Foundation, and I'm looking forward to joining you at the Maternity and Midwifery Festival to talk about my son Kit and neonatal herpes. Kit was born healthy but died when he was just 13 days old from a postnatally acquired HSV or herpes infection. Kit's death was preventable, and so are the deaths of many babies across the UK and the world from the herpes virus. Since he died, I've been working hard to improve awareness amongst health professionals and the general public, to try and ensure fewer families go through the heartbreak and trauma we have. We've made great strides, but there's always much more to be done. And our brand new Think Hands and No Kisses campaign, which is raising awareness of the importance of good hygiene around young babies. Most importantly, I will be telling you what you can do to help reduce more tragic deaths from neonatal HSV infection. If you aren't able to join us on the day, then I hope this video is useful in giving you a bit more information about neonatal herpes and the role of the midwife in keeping babies safe from infection.
Neonatal herpes simplex virus disease, also called neonatal herpes or neonatal HSV, is a rare but potentially fatal disease which usually occurs in the first 4 weeks of a baby's life. It is caused by the herpes simplex virus, HSV, the same virus that causes cold sores and genital infections. HSV infections are incredibly common in older children and adults and typically cause mild symptoms or often no symptoms at all, but in a young baby can be fatal. Babies can catch herpes in one of 3 ways. 1. In utero, in the womb through the placenta or cervix. 2. Perinatal, during a vaginal birth. 3. Postnatal, coming into contact with the virus after birth. Neonatal herpes is typically divided into 3 categories. 1. SEM, infection of the skin, eyes and mouth. 2. CNS, infection involving the brain or central nervous system. 3. Disseminated, infection of multiple organs such as lungs, liver, adrenal glands, brain, and skin. If a baby contracts neonatal herpes, early recognition and prompt treatment with antiviral medication is essential to save the baby's life. Even if treated, a baby may suffer permanent brain damage or die. Often it is not recognized or treated early enough, leading, very sadly, to preventable deaths. The mortality rate for infected babies is 25 to 50% even with treatment. Prevention for pregnant women and people. Pregnant people with a genital herpes history may be offered oral antiviral medication. If a pregnant person develops genital herpes for the first time during their last trimester, then a cesarean section may be recommended. If the pregnant person is not a known carrier of HSV, then they should refrain from oral sex in the last trimester. Sexual activity with a partner with active genital lesions should be avoided, particularly in late pregnancy. If lesions on the breast develop during breastfeeding, feeding should stop from that breast and the lesions be tested for HSV as soon as possible. Prevention for everyone coming into contact with a young baby. If an adult or older child has a cold sore, then direct contact with a newborn should be avoided if possible. If the parent or main caregiver has a cold sore, then the lesion should be treated and covered, and kissing the baby should be avoided. Hands should always be washed thoroughly before holding a young baby. People should not kiss young babies who aren't their own. Health professionals with cold sores should not work clinically. Parents and caregivers should learn how to recognize the signs of infection in a young baby. The Babies at Risk Neonatal Herpes Awareness Survey. We carried out a survey of over 1,500 expectant and new parents. This is what we found. 6 in 10 parents did not know that herpes simplex virus, HSV, infections in young babies can be extremely dangerous. 1 in 3 parents would not ask friends and family to wash their hands before holding their new baby. 45% of parents would allow friends and family to kiss their young baby. 52% of these said this was reluctantly. Numerous parents told us their babies had been kissed by friends and family members without consent being given. These parents said they found it awkward and uncomfortable to ask others to change their behaviour. Quote, "Some people, strangers out in public, would come up and touch my daughter before I even had the chance to say no." Quote, "They do it without asking, which I wish they wouldn't. I would say no." 6 in 10 breastfeeding parents did not know that, should they notice a blister on their breast, they should stop feeding from that breast and seek professional advice. 48% of birthing parents with a known genital herpes infection said it was not discussed with a health professional during pregnancy. Only 15% of respondents were asked during pregnancy about previous genital herpes infections. How can midwives and other health professionals help improve these statistics and keep babies safe from HSV infection? Spread the word. Keep expectant and new parents informed. Ask pregnant women and people about their herpes history. Help break the stigma. Reassure pregnant people that if they carried the HSV virus before their 3rd trimester, then their baby is very likely to have received the antibodies they need to protect them. Don't work clinically if you have a cold sore or herpetic whitlow. Consider neonatal herpes when encountering babies with non-specific signs of infection, including excessive sleepiness and difficulty feeding. Join our thanks campaign, kittarkafoundation.org/thanks. Campaign ad. If you are visiting a new baby, remember your thanks. Think hands and no kisses. Order our resources, all free of charge, for health professionals at kittarkafoundation.org/shop. Thanks campaign posters for perinatal or general settings. Thanks campaign postcards for parents or the general public. Signs of infection wallet-size cards for new parents to help them know when to seek medical assistance with their young baby. If you come across any families affected by neonatal herpes, please let them know about Kit Tarka Foundation. For more information and to support our work, visit kittarkafoundation.org. Email info@kittarkafoundation.org or find us at Facebook, Twitter and Instagram with the handle @KitTarka. Thank you for helping us to raise awareness of this devastating disease. Together, we can help save babies' lives.